Hi, my gosh, it's been quite a while since I've done an update. And excuse me, because I just came from the gym, which is a good thing because I'm well enough to exercise and work up a sweat. I know some people with HS have a harder time in the heat, also when they're sweating a lot. Actually, for myself, right before I had my surgery, I was sitting in the sauna. The sauna was making me feel better, but I had no idea it was actually making things worse. It's like once my body temperature went back down and I cooled off, I would be in so much pain. But the sauna actually, I think, got everything flowing and it felt good, but it was causing some more problems for me. So I am about, let's see, I had my armpit surgery July 20th. It is the end of September, so that's what, 2 months post surgery. And I'm healed under one arm, and under my right arm is almost healed. So to give you a little update, or a, give you some history of what happened after my surgery. My left arm, the stitches came completely undone. I knew that they would not hold. The area was just too wide of a space, and they did come undone. My right arm, the doctor removed a few of the stitches after my surgery just to kind of relieve some of the drainage and to make sure that nothing got infected. And oddly, once we actually did remove the surgery, not the surgery, I'm sorry, the stitches, even from the ones that came undone, they were still in the skin or attached to the skin. So he removed those probably about 6 or 7 weeks, about 6 weeks post surgery, I think. And my right arm, he removed the stitches as well. But there was a space about this wide in my right arm that wasn't healed. So the left arm was worse, and the stitches came undone within a week after the surgery, but it healed, I would say, nicely. Uh, um, Nothing's still open on that side. The right arm was the one that was stitched, and for some odd reason, there's still an opening there. I haven't had any new flare-ups, thank God. That was a big concern for mine, or at least not right now. I feel some days my arms are tender, and I think that's just the healing process. A little bit of pain is common with the healing after the surgery. I'm able to work out again. I started walking probably about a month and a half after the surgery, and I wanted to be mindful of what my body felt like, what my arms felt like, what it felt like to sweat in that area. If I would sweat in that area, I wanted to know what it felt like. So I kind of eased back into my my workouts, probably like 15-20 minute walks, and then I was able to start back running and doing some light lifting. Of course, my arms are still restricted as far as stretching overhead and whatnot, but I can get my arms up a little bit higher than before. And I don't know if you can kind of see what it looks like. It's poking out in the back. The surgeon said that eventually that would get better. It would flatten, and it's like that on both sides. He put me on, I want to say it's called sulfur something, some type of silvadine, something like that. I'm going to mispronounce it. I just can't say it right. But it was a cream. And he told me that they use it for burn victims. So once my stitches came out on my left side, that's what I used to just, it was almost like a icing, like a Cool Whip almost, that my husband would fill the opening with. And y'all, it actually helped. It didn't hurt. It didn't burn when it was going in there. It felt odd because you're basically filling this cavity in your body with something. But I think that sped up the healing process. I mean, when I would go back and see my surgeon for my follow-ups, every week he would be surprised, like, wow. He would be excited. But, it made me feel good that my body was doing what it needed to do. It was healing. I thought it would take a long time, just based on the way it looked. I thought it would take a long time to heal, but it didn't. So right now, what am I doing? I'm paying attention to any tender spots, aches, pains. I'm always touching, pressing, seeing how I feel. So I'm in Florida. Hurricane Irma passed through here a few weeks ago. That was a stressful time for us. I decided to evacuate, and I went to New Orleans, and it took me about 13 hours to get there. I think the stress of everything, the moving, the lifting, the packing, things like that, it did irritate the incision. My left arm, it opened up a little bit, not much, but a little bit. So I was sore and it was draining a little bit while I was out of town. And I got 2 new flare-ups. I did, not under my armpits though, in the groin area. So when I got back in town, my surgeon looked at the areas to make sure that it wasn't, this HS just didn't migrate someplace else. And it wasn't so bad, so he gave me some doxycycline. Said a lot of HS patients just keep antibiotics on hand sometimes, I guess. I never found that they were effective with my armpit areas. So we'll see how it is with the groin areas, because like I said, it's not that bad, but I do think it was a direct response to just the stress, because as soon as I got to my relative's house and I was safe and the drive was over, traffic was over and all of that stuff, I got sick. I caught a cold. I got 2 flare-ups on each side of my groin, and I stayed sick for an entire week. And once I made the drive back home and saw that we had no damage to our property and everybody was okay, I was able to recover. I felt better. The cold finally went away and the flare-ups went back down. So that's something I will say. Monitor your stress. Pay attention to your stress level and pay attention to how you feel, particularly if you're getting the surgery done or you've just finished the surgery. Just pay attention to how your body feels. If you're a person like me, I like to exercise. I hate having to skip my workout, so I immediately wanted to jump back into it, but I did allow my body time to recover, to rest, and to just heal. And I think that might be one of the big indicators as to why my arms healed as fast, not as fast as they did, but they healed well. I put it that way. So I'm grateful that I had a plastic surgeon who was experienced with HS and he was familiar with it, how patients should handle post-surgery and things to look for, especially with the fact that HS can move to different areas in your body. I did have my surgery at the VA hospital here, and I have no complaints. I believe that the team here, they took really good care of me with going into the surgery, post-surgery, all of my follow-up appointments. I'm still seeing my surgery even almost 2 months after the surgery, because we have to keep an eye on my right arm. As you can see a little bit, maybe the sun back here. But this incision wasn't as long, but I do have another spot under my right arm that we're monitoring. Possibly to have to go in and do another surgery just to remove that area. Overall, I do not regret having the operation. I do not regret it. I don't feel like it was a bad experience. And y'all, to be honest, this is the most pain relief I have had in the last 2 years. So I'm trying to do as much as I can. I just moved. We bought a new home. I moved. Taking my time unpacking. And also, I will say this, therapy. A lot of people kind of forget about the mental health aspect of having a chronic illness and dealing with a lot of pain. But I started going to see a therapist at the VA hospital, and we don't necessarily talk about chronic pain, but we just talk about perspective a lot. Cognitive therapy, how your thoughts affect your mood and how your thoughts can affect your actions. And with HS, there are a lot of days that I know personally speaking, I wanted to just go hide. I didn't want to move. I didn't want to see anybody. I didn't want to see the sunlight. I just wanted to hide because the pain's not going away. It doesn't seem to ever go away. But during the whole recovery, the process leading up to my surgeries, I was in therapy. I still go to therapy. I'm glad that I go to therapy because we talk about things that I never really expressed or ever really thought that it was something that I needed to deal with. So even if you don't want to go to a therapist, but you have somebody who you can talk to, support groups and stuff, I highly encourage it because dealing with HS is bad enough. Going through it alone is just the worst thing that you could possibly do. Don't go through this by yourself. Try to find a support group or a therapist or somebody you can talk to about how you're feeling and to get some reinforcement, some positive reinforcements and encouragement for you to press on through the medications, the treatment, surgeries if you have to get those as well. So that's just a quick update. I hope that this page finds you well, recovering, healing, and just continue to stay on top of your treatment options and get involved with support groups, a therapist, and find a good doctor, find a good medical team to help you through your HS. I will be in touch. Take care.